All right. Hi to all. This is Dr. Mitchell Yas, and I am live on YouTube. This is my first time ever trying this medium. I have done plenty of Facebook Live sessions, and I thought that they've gone very well. And as I'm experiencing more and more opportunities to reach people through different mediums, I actually found out about the idea of doing a YouTube live session. So I figured I would give it a try and see what happens and see what kind of response we get. The whole purpose of these sessions is to give people an opportunity so they can get a better understanding as to why they're having chronic pain or other symptoms, and create an opportunity for them to learn more about the understanding of why pain begins, what keeps pain going, what is the typical method that is being used globally through the medical system, and what makes the Yas method so unique in its ability to diagnose and treat pain. So that's the purpose of these sessions, and I always like for them to be an open forum style. People can comment as much as they'd like. If they want to discuss their particular situation, I'm always open to discussing that. If they have comments about the role of the medical system in its attempt to diagnose and treat pain, we can discuss things more on a general topic level. It's whatever people want this to be. I always want people to feel that I am a servant to them, that I am here to help them understand how to ultimately achieve a pain-free, fully functional life, because that's really what this is about. You often hear about people talking about how to address pain, but people still are not quite attaching the deficit of pain to the deficit of function. And in fact, what's going on is these symptoms are impeding people to function at a certain level. So I could certainly try to limit or extinguish your pain by having you lie on the couch and have you tied to that couch. That might help to resolve your pain, but what is that going to do in terms of your functional status? It's going to do nothing. In fact, you'll be able to do nothing. And what I found over my 27 years of treating people for pain and other symptoms is that most people will actually have a deficit in function. They're unable to go up a flight of stairs. They're unable to kneel down. They're unable to walk for a period of time. They're unable to sit for a period of time. And ultimately, it is this limitation in function, which is certainly due to a set of symptoms, which leads the individual to finally seek care. So in most cases, it's not really necessarily the symptom, it's the inability to perform a functional task that leads to seeking medical care. We have Leanda out here, and she said, you helped me with my hip pain, but now I have a pinched nerve in my neck and a lot of arthritis. I've been doing traction. Is there anything that you that can permanently fix this other than surgery? So Leanda is bringing up a incredible point, which is that I am assuming that you established that you had arthritis and pinched nerve through an MRI or an X-ray. I would assume that's how they identified this for you. And if in fact that's true, all that's happened is that the use of correlative theory has been applied, which is to say that you are having some sort of symptoms in your neck. And since an X-ray or MRI found pinched nerve and arthritis, then it must be the cause of the symptoms. And that is an absolute fallacy. Correlative theory is also known as junk science. It is the equivalent of saying, if I open my front door, when the sun rises, I could say opening my front door causes the sun to rise. Clearly, that's not the case. You also want to look at it as, well, since the pinched nerve or arthritis was found at the time that you're having your neck pain, and that is what is being told as the cause, then you could also say, well, if they found two elbows on an MRI, that as well could be identified as the cause of pain simply because it was found that you have two elbows while you're having your symptom. It just doesn't work. These structural variations, like this arthritis and pinched nerve, most likely have been there for years, if not decades, prior to you having these symptoms. The fact that they're identified for the first time at the time you're having your symptoms is not it cannot be utilized as a means of saying they are the cause of your symptoms. You wrote, my right arm is painful and I've lost strength in my right hand. Well, first off, there's a possibility that something's happening in your arm or your hand that's leading to those symptoms. But is it possible, let's say that there was a nerve, for instance, at the front of the neck, a group of nerves that join together called the brachial plexus, which actually stem from all the cervical spine nerve roots, come together to the neck, then run under the collarbone and run down to the arm. It is possible that a muscle in the neck has actually strained, thickened, and is impinging on the nerve that runs down to your arm, which is leading to that. I don't think most people recognize that muscular causes don't necessarily present themselves as a muscle straining. A muscle can strain and elicit pain, but muscles can also cause joint pain because the position of the joint surfaces that make up the joint are determined based on the muscular attachments. So if there's some sort of weakness or imbalance, that could lead to a misalignment of the joint surfaces, which would lead to pain in the joint, but there in fact is nothing structurally wrong with the joint eliciting that pain. Another possibility is what we're talking about. You could actually have a nerve create a neurological symptom, but it is not a structural variation of the nerve. It is a muscle in the area that has strained, thickened, and is impinging on the nerve. So you have a muscular cause creating a neurological symptom. The greatest example of that is sciatica. Sciatica is actually the result of the piriformis muscle, a muscle in the gluteal region, impinging on the sciatic nerve. There is actually no connection of the sciatic nerve to the lumbar spine, and therefore any structural variation of the lumbar spine, a herniated disc, stenosis, pinched nerve, arthritis, could never create sciatica. So in your particular case, it is possible that what's happening is you have a muscular deficit that's actually causing a neurological symptom. What we would do is you could also look at your posture and see, are you having forward shoulder posture? Do you have forward head posture? These types of variations in posture could also lead to that muscle thickening, straining, and impinging on the nerve. So if you're having that symptom and you also simultaneously are having a postural deficit, that would be a representation of a muscular cause. So posture and symptoms, posture should be perceived, or an altered posture can be perceived as a symptom, just as pain or altered sensation is. You wrote, pain was in my right shoulder blade, burning light of height. Now you're describing the fact that the symptom could actually be from your rotator cuff. You've hit on another possible cause of an altered sensation. Not only can nerves refer symptoms, but muscles can refer symptoms. And in fact, you're hitting on one that I try to bring up commonly to people, which is to say that oftentimes people, when they sleep on their side, end up waking up with some altered sensation at their hand. And they're told this must be from the nerve root from the cervical spine. It's always coming from the neck, when in fact, the rotator cuff, which sits on the shoulder blade, can actually refer symptoms down to the hand. And if you were to look up a chart which showed a infraspinatus trigger point chart, that would actually show you where the symptoms would be referred to if in fact the rotator cuff strained. So it could very well be that the symptoms you're describing, maybe you are having pain in your neck, that could be an independent symptom from the symptoms down the arm. But that's why you need a physical evaluation. Just as we had done that Skype evaluation to determine what was going on, we also have to do something of the same type of thing. Symptoms can only be identified by understanding what tissue is in distress. And the only way to really understand that is to do a physical evaluation. This idea of simply finding structural variations at the time you're having symptoms and saying that that's the cause of your symptoms simply because they're identified is absolute nonsense. It's bullshit. It's been bullshit from the very beginning. For the last 40 years, the advent of the MRI as the primary mechanism for diagnosing the cause of pain has exactly led to exactly where you see a global chronic pain epidemic. It's not accidental that the chronic pain epidemic has began simultaneously with the use of the MRI. It's a direct resultant of it. You wrote, you're right, sleeping on my right side and shoulder kills me. So right off the bat, that's telling you that there's probably something going on muscular on that side. It's really highly unlikely that the pinched nerve or the arthritis in itself, let's make that really clear. Arthritis does not elicit pain. Can we make sure everyone recognizes? We have Dave, who has just joined us. Thanks for coming on, Dave. I'm glad you're here. Chime in anytime you want. I'm bringing up a critical point that I don't think most people understand, which is that osteoarthritis does not cause pain. That has been another one of the great fallacies that have been perpetuated for years and allows people to be a prisoner of the medical system, because as long as you are convinced that arthritis is the cause of your pain, well, who can fix arthritis for you? Can you fix arthritis yourself? Of course not. Only the medical system can fix that for you. And the answer to fixing that can only come in the form of a surgery. And since surgeries fail so highly, the answer to you is going to be, well, if you don't want surgery, at best, we can only try to minimize your symptoms or mask your symptoms through medication. And so what do you see people who are diagnosed with arthritis ending up with? Epidural nerve blocks, cortisone shots. By the way, cortisone shots are never cortisone themselves. They're always combined with lidocaine, which is an anesthetic. So you see the medical system doing nothing more than keeping you a prisoner by basically keeping you attached to the idea that you only have one choice if you have a structural variation, which is surgery. And if you don't want that, you will have to stick with the medical system's attempt to do nothing more than mask your symptoms. And that's why you see people sustaining their symptoms forever and ever and ever, going back and back and back to the medical system. And that's the danger of the use of diagnostic testing. Diagnostic testing cannot identify muscular causes. I don't think anyone understands this idea. You think that if you go and you get an MRI, all possible causes of your symptoms can be identified. They'll find the right one. They will resolve the distress of that tissue. And that's the end of this. It's absolutely nonsensical to recognize that muscular causes, those 4 different types of muscular causes, a muscle eliciting a symptom and creating pain at that muscle or at a muscle that's compensating, pain at a joint, not coming from the structure of the joint, but misalignment of the joint surfaces due to a weakness or imbalance of the muscles that locate the joint surfaces. Right? Another one is muscles referring symptoms, just like we were talking about a moment ago. This idea of the rotator cuff referring symptoms down to the hand, and it doesn't necessarily have to be pain. It can be altered sensation, or finally, a muscle impinging on a nerve like sciatica in the gluteal region referring symptoms down the leg. That's a muscular cause creating a neurological symptom. Or a possible case of numbness in the hand, the entire hand coming from the brachial plexus in the neck being impinged by a muscle in the neck. Not one of those types of causes will ever show up on an MRI or an X-ray. And more importantly, there is not a single medical practitioner educated or trained to identify these causes. Just recognize that idea. I don't care if you go to a chiropractor, an orthopedist, a neurologist, a pain specialist, a rheumatologist, a podiatrist. It doesn't matter who you're going to. If the cause of your pain is muscular, and I think, Leander, you're starting to see there is that possibility. If you're going to someone in the medical system, you will never get that diagnosis. And if you don't get the right diagnosis, doesn't it kind of make sense why you would sustain chronic pain? People think chronic pain is because, oh, they know what's causing it. They just haven't quite gotten the right treatment. It's never an issue of the treatment. It's the fact they're not treating the tissue in distress. Let me just catch up here. Dave said it's all muscular. I have the same problem with my shoulder. That's right. Dave has severe limitation of the range of motion of his arm. And if he were to go to an orthopedist, they're going to find some arthritic change and tell him that's the problem. When in fact, his rotator cuff is so shortened, so strained and shortened that it's not allowing for the normal motion that has to occur of the head of the arm bone in the shoulder joint to allow it to drop down, to allow him to raise his arm. He actually has a muscular deficit leading to a change in the mechanics of his shoulder joint. So the reason he can't raise his arm is because the rotator cuff is shortened, impeding the normal mechanics. I don't give a crap if he got 3,000 surgeries. He can get joint replacements. He can get anything he wants. But if he never changes that muscular deficit, that mechanical movement of the arm bone in the shoulder joint will never be correct. And he will never, ever have normal function of his shoulder. Leander's still writing, traction does help the pain. It only helps the pain because it's stretching your muscles. That's all it's doing. It's stretching your muscles. So unless you plan on getting traction for the rest of your life, you better come up with an alternative plan to figure out how to address the tissue in distress by resolving the stress of that tissue. And most likely what's going on is that the muscles that support your neck have strained and they're having difficulty supporting your head. So as a result of that, they strain. The more you try to support your head, maybe you're looking forward on your phone, you're on a computer, something's going on. That's what's leading to these muscles straining. And until you resolve the distress of that tissue, which is the result of weakness, the only way to correct that is through the appropriate strengthening. If you were to strengthen the appropriate muscles that stabilize and support the head, you wouldn't need traction ever again. And I'm trying to understand, why would anybody, even if insurance pays for this, why would you want to continue to go back for traction, knowing it's going to have to be paid for, and it's never addressing or resolving the cause, versus identifying which muscles are specifically responsible for the cause of your symptoms, developing enough strength in the appropriate muscles to where their force output is greater than the force requirement of your activities, thereby ending the need of the muscle to elicit pain, thereby ending pain for good. Why isn't that the more common concept for people? It's been confusing, and Dave probably has an answer to that, but he wrote, no X-ray or MRI, CT scan will show any muscle issues. Doctors then put you on pain medication because they don't know what else to do. And that's a critical point to make, is that the doctors that are doing all this stuff, it's not that they're evil people. It's not that they're bad people. It's not that they're malicious people. They're just ignorant. This is the education that they've been given. They treat you based on the education they've been given. And as a result of that, they do what they've been educated and trained to do. So if someone tells you that you need traction, they're doing it because that's the only alternative. What you have to understand is that these muscular deficits, which I've established over 27 years and 15,000 people, in 98% of cases, the cause is muscular. Think about that number. It's virtually everybody. 130 million Americans, 1 billion people worldwide, and the majority of these people, the cause of their pain is muscle. So if you're going to the medical system and they are not educated or trained to identify these muscular deficits, it should be quite obvious why you never get the appropriate treatment to resolve the distress of the tissue that's eliciting your symptoms, and why your symptoms continue. Let's say in your particular case, you end up getting a surgery for your neck, a herniated disc or whatever it is, or getting your arthritis addressed, and you still have that muscular deficit. It should be very apparent that that muscular deficit is still going to remain, and you're still going to have your symptoms even after whatever surgery you get. If you look at the failure rates for like back surgeries, the failure rate's like 70 to 80%. The medical system actually created the diagnosis failed back surgery syndrome to account for this fact. All these failures, they said, well, we don't understand what's going on, so we need a diagnosis so we could move forward. And they create the diagnosis failed back surgery syndrome, which is to say that we did a surgery, you had a symptom, we did the surgery, and your symptom is the same, if not greater, and we don't know why. That's the purpose of putting the word syndrome there. Syndrome implies a set of symptoms without an understanding as to its cause. I mean, you really have to wrap your head around this idea. They created the diagnosis failed back surgery syndrome, not me. I mean, all these things represent the failures of the medical system in terms of diagnosing, primarily since the advent of the MRI as the diagnostic tool. 22 million Americans are addicted to prescription pain medication. There is no question that rates of depression and rates of suicide have skyrocketed over the last 30, 40 years. I personally have treated hundreds of people who came to me and straight out said, I will put a bullet in my head. Tomorrow, if you do not end this pain, I will not live another day like this. Life is not worth living if this is the way it's going to be for the rest of my life. It's a horror. It's a horror. Pain consumes people's lives. I've been working with Dave now for about 2.5, 3 months, and Dave would be quick to tell you how despondent he had gotten after 3 years of not being able to get out of bed. It's horrible when you start thinking that every day is going to be this and that there's no chance for a recovery to some sort of quality of life that's reasonable, that's worth living. Then it makes you start questioning, then what's the point of living? And it's very hard. It's taken a personal toll on me working with this level of pain and this number of people who are in this circumstance. It's terrible. I feel blessed that I've been given this opportunity to have this very, very unique understanding. The method that I employ is a method that I developed kind of right out of medical school for the very reason that as I was going through it, it just didn't seem like I was educated appropriately to get the right type of diagnosis that would allow me to feel confident that I was treating the very thing that was eliciting the person's pain. I decided this was a second career for me. I went back to medical school at 30 years old. And so I had decided that if I was going to do this, I wanted to leave and begin to practice with an understanding that gave me a high probability that when that person finished with me, they were going to be pain-free and fully functional. And I knew I hadn't gotten that from school. So I decided I was going to try to develop my own method. And this concept of a relationship between symptoms and causes just were very natural. Most people recognize that there is that connection because if someone's having pain at the chest and the left arm, they don't ignore that, right? No one ignores that. They immediately say, oh my God, I think I'm having a heart attack. You think you're having a heart attack because you have recognized that that symptom of pain in the chest and the left arm is coming from your heart. And it's the heart's attempt to create conscious awareness to you that it's not functioning properly and it needs help. That's why it sends out that signal. So everyone recognizes that that symptom specifically is representative of distress of the heart. If we talk about numbness of the entire side or loss of function of one whole side, people have recognized that that symptom is representative of a stroke, dysfunction of the brain. If people are having difficulty breathing and pain in the upper back, they represent that, associate that symptom, group of symptoms with pneumonia, some sort of lung deficit. So in terms of generalized relationship between symptoms and causes, people kind of get the concept, but that got completely distorted when the MRI was developed And this idea of simply whatever shows up on the MRI must be the cause of my symptoms became the standard of care. The scariest thing that people should know is that by 1994, they finally said something's just not right. This relationship is just too extreme. And so they said, you know what? I think what we should do is try to get some MRI findings on people who don't have pain, and let's see what we find with that. And what they found was that 70% of the population who has absolutely no back pain have bulging or herniated discs, 70%. A more recent study showed over the age of 60, 90% of people with no back pain have bulging or degenerative discs. And the conclusion of the study was that, therefore, degenerative disc disease should not be considered a cause of pain. They actually concluded that was it. If almost everybody who doesn't have pain has degenerative disc disease, why would you think those people who have pain, it's causing the pain? The more rational thought would be there must be another tissue in the area creating the symptom, and you just happen to find the degenerative disc disease at the time the person was having pain. But the funny part is that if that person comes to me and I turn out that it's a muscular cause, and I resolve the distress of the muscle and the person no longer has pain, we can now send him back for the X-ray or MRI, and guess what they'll find? The same degenerative disc disease. I didn't fix that. I didn't do anything with that. So here you have a person who had degenerative disc disease with pain, and then you have the same person with degenerative disc disease without the pain. So what would make you think that the degenerative disc was causing the pain in the first place? It's cuckoo. It's mind-boggling that this has gone on so long. But what it comes down to is that it's all about brainwashing. It's about coercing people to believe something. If enough people say something, then it must be true. And that's what's gone on for the last 40 years. And it's very sad because you're talking about 1 out of every 7 people in the world suffering from chronic pain. And this is destroying people's lives. Divorces are occurring, loss of communication with children or parents, inability to have jobs. As I said, depression. All these things are occurring for one reason and one reason alone: misdiagnosis. Misdiagnosis, that's the answer. We could look at any particular area if you want to just look at different areas and see how this happens. So the classic lower back pain issue, if the person's having pain off the side, I want you to just understand the logic of how you use a physical evaluation over the use of diagnostic tests. So let's say a person's having pain, and if this is their spine, they're having pain 2 to 3 inches off either side of the spine. So the pain is 2 to 3 inches away from the spine. They get an x-ray and it says they have a pinched nerve or arthritis or stenosis or something of that nature, which is common. Pretty much everyone has it. And because it's found at the time they're having pain, it is said to be the cause. I want you to see the logic of how you can actually differentiate this. So if in fact the pain is 2 to 3 inches away from the spine and they're saying it's coming from some sort of structural variation from the spine, where would I have to press to really try to incite the symptoms? The answer would be the spine, because that's where they're saying the cause is coming from. So I could press on the spine from here to eternity, and I pretty much can guarantee you I will never incite the pain that's coming from 2 to 3 inches away from the spine. But if I were to press 2 to 3 inches away from the spine on that spot, I probably would incite the pain pretty heavily. And if I were to do that, I have just shown you through a presentation of the physical symptoms of this individual that the pain is actually not referred, right? Referred means that there's a cause in one place and the symptom is someplace else. You're being told that your symptom 2 to 3 inches off your spine is being referred from your spine. Well, I pressed on the spine and I didn't bring it on, but if I press on the area, that is what is known as point tender pain. And that is to say that the tissue I'm pressing on is the tissue eliciting your symptom. which in this particular case would be your lower back muscles, the quadratus lumborum. So anybody in the world who is having pain 2 to 3 inches off their spine simply needs to have somebody press on the spot 2 to 3 inches from the spine. And if that brings on their symptom or makes it worse, I am personally telling you to discount any MRI result that you've been given, any X-ray result that you've been given. You have just guaranteed that that symptom is not coming from a structure of your spine, period. Period. We could talk about another one, groin pain. The most common symptom associated with arthritis at the hip leading to hip replacements. It's the primary reason people are getting hip replacements. They have groin pain. They get an X-ray of the hip. It finds some form of arthritic change. The doctor asserts that since the arthritic change was found at the hip at the time you're having your groin pain, it must be the cause of your pain and you need a hip replacement. It's that simple. That's the way it works. So, same theoretical basis. Let's go on to this premise. If I wanted to prove that the arthritis at the hip was causing the pain in my groin, where would I have to press? I would have to press on the hip. That's where the arthritis exists. So I would lay the person on their side, let's say it was their left hip, and I would push down as hard as I can to take the femur, the thigh bone, and jam it into the hip joint as much as possible to really aggravate the arthritis. And if, in fact, that was causing the pain in the groin, you should immediately feel a referred symptom to the groin. Well, in 15,000 people, thousands of which I've treated for hip replacements, I pressed on that hip joint and not a damn symptom was referred to the groin. Now I lay the person on their back and I press in the groin, searching for a point where their pain is. They point to where their pain is. And if I can press directly on that spot where their pain is and they go through the roof, again, I have just shown that the pain is not referred. It is actually point tender. The pain is coming exactly from the tissue where I'm pressing and where the pain exists, which in this case could be a muscle, the sartorius muscle, the gracilis muscle, the psoas muscle. So again, we could use palpation and the presentation of the person's body's physical symptoms to determine whether, in fact, that diagnosis that was given strictly by X-ray or MRI is valid or not. And again, if I press in the groin and the person's symptoms are exaggerated and I press on the hip and nothing happens, I promise you, without any question, any hesitation, getting that surgery will do nothing to correct the groin region pain. And you don't really have to take it from me. I'm telling you from a theoretical perspective. All you have to do is talk to anyone who's had a hip replacement, and you will find out that that groin symptom most likely had gotten substantially worse after the surgery. And in fact, that's the primary resultant that people get after these surgeries. They find that their symptoms are worse. And so the doctor, in his role of trying to keep you going, says, oh, you know what happened? You know how I did that hip replacement? Well, the prosthetic isn't fitting properly. Anybody here, anyone who ever listens to this, if you've had a hip replacement and you've had revisions, tell me if this is exactly what you've heard, because I'm sure it is. Oh, the prosthetic isn't fitting the way I thought it was. Oh, the cement gave way. Oh, it's just not right. I have to do a revision. And people are getting revision a month, 2 months, 3 months directly after the hip replacement to correct a symptom that was there before the first hip replacement. Think about it. The groin pain existed before the hip replacement. You get the hip replacement, the groin pain remains. And the guy goes on to tell you the reason that you're having the groin pain is because the hip replacement wasn't done correctly. But if the pain began before the hip replacement, how could the hip replacement have anything to do with the pain? I hope people, when you listen to what I'm saying, this is making sense to you. You don't want to be one of these hundreds of thousands, if not millions of people who are getting these surgeries and ending up with greater, if not the same, if not greater pain. And then here's the sickest part of this. Let's say that was your left side, right? Well, now, because of the surgery and the swelling and pain from that surgery, you're not going to weight bear on that left side at all. You were already weak, which was the true cause of your pain. Now the post-surgical symptoms prevent you from weight bearing on the left side. What side do you think you're going to weight bear on? You're going to weight bear on the right side. The right amount? The correct amount? No, excessively. So what's going to happen on the right side? You're going to end up with strained muscles and pain. Maybe it's around your knee. Maybe it's around your hip. Maybe it's around your ankle. But guess what? You're going to go back to that guy and they're going to say, wow, what a success. You don't have any pain on the left side anymore. That must have been a successful surgery. But I understand you're having pain on the right side now. Let's take an x-ray. Oh my God, you're bone on the right side now. Now you need a replacement, a hip replacement, a knee replacement, an ankle replacement on the right side. And if you're not paying attention to this and really thinking about the logic behind it, I guess you can be swayed. Yep, he's right. I don't have pain on the left side anymore. Oh, and I guess the right side must be the arthritis that must have been festering for years and years and years. And suddenly now it's shown its angry face. This is what happens to people constantly. I can't begin to tell you how many people I've treated who had pain on the left side, then pain on the right side, then pain on the left side, then pain on the right side. And they keep going back and forth. And they're wondering, why is their pain moving? The reason pain moves is because it's muscular in nature. And the reason that muscles elicit pain is because the force requirements of your activities are greater than the force output of your muscles. What you must understand is you live in a gravitational environment, my friends. You got gravity pushing down on you. And for you to do anything other than laying flat on the floor, you're going to need some strength to push yourself up and work against that gravity. And all your muscles that are trying to create a particular activity better be equally strong. All the muscles must have at least the force output for the requirement of that activity due to the gravitational push down. If they don't have the force output, I don't care if you have 9 that are good. If one is bad, that muscle will strain, cause other muscles to compensate, and you will end up with pain in time. That's why you're having pain. So on that first time when you had pain on the left side due to the muscles, and then you got that surgery, that actually just led to decreased weight bearing, which now made you excessively weight bear on the right. You've actually induced a greater force requirement on the right side than what the right side muscles were capable of, because you should have been weight bearing 50% on the left, 50% on the right. Now you're doing more than 50% on the right. So of course those muscles are going to strain and elicit pain. And look who you're going to determine the cause of your pain: an orthopedic surgeon. An orthopedic surgeon. Think of the logic. You're going to a surgeon to determine if you need surgery. And I often hear people tell me, oh, well, he's a very conservative person, or she's a very conservative person. They only want to do it if it's a last resort, and they want to give it time. What you're not realizing is they've got such a revolving door of people coming in. They got a 2-3 month float of people that they're going to do surgery on. So this conservative air really isn't so much a conservative air. It's that they got to make room for you. And the other point to that is this idea of surgery as a last resort has to be one of the, you really have to look at this and think about this and think about how perverse that concept is. What if I'm right? What if you do have a muscular cause? What was surgery going to do to correct the cause? Nothing. It's only going to make your ability to weight bear worse, which is going to lead to a greater difficulty of those muscles that were strained already eliciting your symptoms. And it's going to lead to a greater presentation of your symptoms. If the diagnosis was correct when they offered you this surgery, after the surgery, you should be pain-free and fully functional. If they established what tissue was in distress, a joint, a nerve, whatever, why is it that so many people end up with the same, if not greater surgery, greater pain? And I've experienced this. I've treated innumerable people. It's just can't be right that they're identifying the correct tissue and everybody is ending up with the same, if not greater pain. It's just, I mean, it's just, the evidence is so clear. So this orthopedic surgeon doesn't look for multiple possible causes of symptoms. I think that people think that you're going to a doctor and he's this great diagnostician and he's really working through a variety of potential causes. The orthopedic surgeon is trained to look for structural variations and make them be what they used to be. And that's it. If there was a muscular cause, this is not the individual who's going to be able to diagnose that. I can assure you there isn't a chance in hell that that orthopedic surgeon is ever going to identify a muscular cause. It's just not the way it works. He'll try to, or she'll try to convey to you that they're being conservative and they don't realize that, hey, listen, if you're willing to go months and years of never getting that surgery, but you're willing to get cortisone shots or epidural nerve blocks or take prescription pain medication, that's still money in the bank. I don't think that's such a bad concept for them. They don't get the big haul. They don't get the $50,000 or $100,000 or $200,000 surgery, but they'll get enough people down the road. So as long as you're staying a part of the system and always coming back, I mean, you're still part of the system. The scariest thing is that if in fact I am true and 98% of cases are muscular, then what does that say about how many people could be lifted out of the medical system by simply first understanding that the cause of their pain is muscular, then understanding which particular muscles are involved, and then understanding how to perform the correct exercises to allow them to develop enough strength in the muscles to where their force output is greater than the force requirement of their activities, to where they are then, in fact, pain-free and fully functional. Literally, not just not having pain, but living the life they choose, doing what they want when they want. Imagine what that means. 98% of people who are diagnosed by diagnostic tests, MRIs and X-rays, have been falsely diagnosed. The cause of pain, in fact, is muscular. And I always wonder, if someone did find out about this, you've heard about the Yas method, maybe you're watching this, maybe someone told you about it, maybe you Googled me. I can't possibly comprehend why you wouldn't say to yourself, you know what? Maybe I should at least check this guy out. Let me see if this even makes sense. There's unlimited opportunity. There's YouTube videos, there's Facebook videos, there's my website, mitchellyas.com, where you could go and there's a blog of 100 posts there. There's my books. There's my book, Overpower Pain, Paincure RX, the Yas Method for Pain-Free Movement. There's such unlimited opportunity for people to get this information. Why wouldn't you at least test the idea that maybe your pain is muscular? You're having groin pain. Why wouldn't you at least say, hey, man, there are muscles in the groin. Maybe it is a groin strain. Maybe I should try the exercises before you would be so quick to get a surgery. These back fusions have failed so miserably that it's led to 25,000 other more benign surgeries. The magical advent of microdiscectomy, of microsurgery, is because the surgeries before failed so miserably that they're trying to find some sort of surgery that you might be willing to succumb to, that might be more palpable for you to try, because the other surgeries have failed so miserably. Think about what that means. Why would you go through any of that kind of stuff? Why wouldn't you at least try and see, is my pain muscular? Geez, if someone's having lower back pain right across the back, all I would try to tell you to do is stretch your quads, your front thigh muscle, especially if you see that you're having an excessive arching of your lower back. Like this should be the comfortable type of curve of your lower back, and you're one of these people with this extreme arching of your back. Shit, man, just try to stretch your quads and see if your pain diminishes. If your quads stretching caused the pain in your lower back to diminish, you just prove to yourself that it's a muscular cause. I wouldn't give a crap how many herniated discs you were told you have, how much stenosis you have. That's all crap. You have to stop thinking that because these structural variations are identified at the time you're having their symptoms, that they are somehow the equivalent of cancer. Oh my God, they found spondylolisthesis. I need that to be corrected. Oh, they found stenosis. I know the words are scary. They sound so scary, and yet they have such benign meanings. Stenosis just means narrowing. Some degree of space between the vertebrae has occurred, has shrunken. Big deal. Gazillions of people will live with that without a symptom. Spondylolisthesis. Oh, it's a little shifting of the vertebrae front to back. Because that happened doesn't mean that there's a symptom derived from that. The studies have shown us many people with no pain have all of this, everything you've heard that requires some sort of surgical intervention has been found at the same percentages in people with no symptoms. How do you account for that? You have to take pause and say to yourself, if these things cause pain, then they should be found in everyone with pain, and everybody who doesn't have pain should not have these at all. 63% of people who have knee pain are found to have meniscal tears. Of the people who have no knee pain, 60% are found to have meniscal tears. What do you think that means? Do meniscal tears cause pain? Well, then how do you account for 60% of people with no pain having meniscal tears? Clearly, meniscal tears don't cause pain, and the individual who's having pain at the time it's identified, it's from another tissue, a muscle causing a misalignment of the joint surfaces that are leading to them rubbing inappropriately, causing pain. Doesn't that even remotely sound more logical than that there's magical pain-initiated meniscal tears and the magical non-pain-causing meniscal tears? All of this stuff is insanity, absolute insanity. They have done so much writing about the asymptomatic and symptomatic disc. I'd like to do any type of blind study and show these experts a bunch of discs and ask them to point out which are the ones, based on a physical presentation, which are the ones that create pain and which are the ones that are asymptomatic. And I can assure you that there is no such thing. They wouldn't be able to do it to save their lives. I'd be more than happy to show any experiment to any one of you where you just show 10 MRIs and ask any pain specialist to identify with those MRIs which people are in pain and which aren't. And you will find out it is impossible. And the reason is that studies have shown that there's not even, forget the idea of pain or no pain, the intensity of pain has not been correlated to the intensity of the structural variation. So there are people with massive structural variations who have absolutely no pain, and people with virtually no structural variation and massive level of pain. How do you account for that? You're being told that there's this extensive deterioration occurring, and that eventually at some point of the deterioration, that's why you're having your pain. Well, how do you account for people who have severely more deterioration than you, and they don't have pain? This has to be addressed. I've had people who have had left knee pain. They had x-rays of both knees taken. And it showed that the right knee had more arthritic change than the left knee. And the doctor said, I'm so confused. I don't know why you're having pain at your left knee because you have more arthritic change at your right knee. And yet this doctor is suggesting that you get surgery when he just openly acknowledged he doesn't understand your symptoms. How could you possibly accept this crap? It's insane. Dave wrote, set up a Skype session immediately with Dr. Yas to get a diagnosis and treatment. Don't waste your time with the medical system. Dave is right. Thanks, Dave. Dave is right. Yes. The only real way you're ever going to see your symptoms resolved is by understanding what tissue is in distress. That's what this is about. The symptoms you experience come from a particular tissue in distress as an attempt to create conscious awareness to you that tissue isn't functioning properly, right? So the only way to understand that is to interpret the symptoms. That's what the Yas method does. That's what it's for. That's how I designed this. When we do an evaluation, and granted, obviously most people for a period of time were coming to me in person, but certainly with the advent of the coronavirus and the isolation and the social distancing, I got it all. We could certainly do an evaluation and treatment through a Skype session, a Zoom session, a Tango. It doesn't really matter what the mechanism of teleconferencing is, but you certainly can get the proper physical evaluation, which is at the core of the Yas method, through a teleconferencing mechanism. And if the cause is confirmed to be muscular, which it is in 98% of cases, then I could provide you and demonstrate with you the exercises you would need to do, and then you would perform them under my supervision. That's the magic of the Skype session. And there's been a push because of the coronavirus of the medical system to now do telemedicine. Geez, I've been doing Skype evaluations for 5-6 years at least already. And I have a rationale for it. It's because my books are produced, or certainly 2 of the 3 were produced by Hay House Publishing. So they're published here, Canada, England, Australia, India, and South Africa. And I also write for What Doctors Don't Tell You, which is a magazine that is sold in 20 countries and translated into 14 languages. So I've had a lot of international exposure, as well as nationally. I did a PBS special, which I had for 2 years. So certainly, as a result of that, lots of people want me to help them understand the cause of their pain, and yet they're not in a position to have an in-person session. So as a result of that, I developed the use of the Skype mechanism to help me be able to diagnose and treat people who are simply not in a local, a fairly close locale. And I've been doing it for years, and it's highly effective. I've done several for people. And the beautiful part of the Skype mechanism is the fact that the session can actually be videotaped. So at the end of the session, you simply download that session to your hard drive, and now you have that as a reference for an unlimited period of time for you to be able to use when you want to perform your exercises correctly and understand how to use the progressive resistance mindset so that you can cause your muscles to eventually get strong enough to where you have enough force output greater than the force requirements of your activities. So look, Dave wrote, I've wasted 30 years trying to get help. I've seen every specialist there is. I've done all types of physical therapy, even aquatic, no improvement. And the reason Dave says that is simply because the cause of his pain was misdiagnosed from the very beginning. They've been looking for a structural variation when, in fact, what happened in his case was that he strained certain muscles when he was trying to get up from a couch, and it actually led to a misalignment of his kneecap to where anytime he tried to straighten his knee, the kneecap would rub inappropriately, causing pain. Well, since nobody was able to identify that as the cause, the thing just perpetuated. He got weaker and weaker, and ultimately he was unable to get up from a bed, and he's been bedridden for almost 3 years now. So he's tried all the stuff that's out there, and Dave will tell you he's been on the internet probably more than anyone in the world looking for some magic solution. And he will tell you that there's just a lot of quackery out there. As a person in pain, It's sad to say, but you have to protect yourself. There's so much nonsense out there, whether it's from the medical system, whether it's from people just trying to promote different gadgets or ointments or anything, as well as just the idea, even on the Eastern side, the idea of turmeric as a form of addressing your pain is just a fallacy. If the pain is muscular, turmeric is supposed to work based on the idea that your pain is associated with inflammation. But there have to be signs, physical symptoms indicating that inflammation exists. So if you're having pain, let's go back to your lower back. If you don't see swelling, heat, redness, and pain, then I hate to tell you, but you don't have inflammation in the area. And I don't care what your SED rate is. I don't want to hear about this microscopic inflammation nonsense. I'm just telling you where your pain is not the result of inflammation, because you don't have the four symptoms that represent inflammation that exist in that location: pain, swelling, heat, and redness. If you were to sprain your ankle, what do you find at your ankle? Pain, swelling, heat, and redness. If I was to hit you with a baseball bat in your shin, what would you see? Pain, swelling, heat, and redness. If you had a bee sting and had an allergic reaction, what would you see? Pain, swelling, heat, and redness. Someone's having shoulder pain and they can't raise their arm because of pain. Do you see swelling, heat, or redness? No. Lower back? No. Knee? No. Just because someone says the magical phrase inflammation doesn't make it real. Unless symptoms present, just go back and recognize the body is trying to give you signals as to what is in distress so you can resolve it. Your body is telling you, I'm not functioning properly and I need your help. I'm trying to give you cues to allow you to understand what the problem is. That's what the symptoms represent. The only way to interpret the symptoms is to do a physical evaluation, which is at the core of the Yas method. I am not aware of any other method, whether it's medical, non-medical, I don't really care. I'm not familiar with any other method that begins by trying to get the right diagnosis. Most other things that are out there talk about alternative treatments. Oh, just try this and it'll work. I would tell anybody that I ever came in contact with that you should never, ever take or receive a treatment if the individual providing the treatment can't justify what tissue is in distress, how they know that, and how this particular treatment is going to resolve the distress of that tissue. Everybody walks into a chiropractor and gets an adjustment. You'll go for physical therapy. You'll go to a podiatrist. You'll go to all these people and yet never have been given the opportunity. I can't tell you how many people I have treated over my entire career. And I said, so what's your diagnosis? And they say, after a car accident, whiplash. My diagnosis was, whiplash is not a diagnosis. Whiplash is a mechanism. From now on, start to understand that the premise of a diagnosis is to identify a tissue. The diagnosis must include a tissue. Stenosis of the mitral valve in my heart, pneumonia of the lung, cirrhosis of the liver. Whiplash is not a diagnosis. And yet everybody and their mother will accept that as if it means something. It doesn't mean shit. Unless you can tell me what tissue. Is it a herniated disc? Okay. If it's a herniated disc that was developed by that mechanism, how do you know that? What is the presentation of the symptom that's telling you? What is your body telling you that's telling you that that symptom is coming from the disc, trying to convey to you that that's its cause? Is it a muscle? Is it a nerve? Is it a bone? That's what you need for a diagnosis. That always has to be. Forget whiplash, just as a general rule. Unless you can get that diagnosis, that tissue in distress that has been identified by some presentation, then I can't imagine how in good faith you could possibly be accepting some sort of treatment. And the answer is, well, because that's the way the system works. You go to your primary care, he wants to refer you somewhere, and you just go. And it's just a shame. I work with a girl, and my God, she's in her 20s. She's gone down the path. And again, it was a simple little, very mild little car accident she got in. She got pain between her shoulder blades. She's been told it's a herniated disc, stenosis. They've gone through the path of physical therapy, which did nothing. She's gone through a couple of bouts now of epidural nerve blocks. She's 20-something years old, and I can assure you they're approaching that magical point at which they're going to say, okay, we've tried everything conservative. I guess we have to try for surgery. And she'll say, oh, I won't do surgery. Everyone says that. Nobody gets surgery without being under complete duress. You are coerced into surgery. As soon as you walk in that door and they say, we're going to try everything else, but just understand, if nothing else works, surgery is your last option. They are setting you up. They're coercing your mindset into thinking, well, I guess that is a viable option if nothing else works. So that when nothing else works, you have kind of allowed yourself to accept, okay, well, I guess there is nothing else. When in fact, it should have, if in fact surgery was the core, we're going to resolve your symptom, why wasn't that the first attempt? Does anyone ever say that to themselves? If I knew that my mother was suffering from pain and I knew that that surgery was going to take away her pain, why would I say to her, listen, I want to see you suffer for the next 6 months to a year, just so I could make sure that we know for sure. So you can't take it anymore. So you'll then be willing to go for this surgery. I mean, it's psychotic to believe that. Clearly, even the medical system doesn't think that the surgery is the answer based on the evidence. And so they have to use this coercive coercive means of basically getting you to succumb to it, as every time you get a failed treatment, well, don't forget, at the end here, there's always surgery sitting. I mean, it's crazy, crazy. So I'm going to be doing these YouTube live sessions. I'll probably continue to do the Facebook live sessions. I like talking. That should be evident. I like educating. I like helping people to understand things. Most people perceive that the medical system and the body is very complicated, and therefore it's not something that most people can understand. And I simply disagree with that completely. I think if you're very good at teaching, I think you could make things that are medical quite easy for people to understand. I don't know if Dave's still on there, but Dave would acknowledge, before I do anything with him, I've always explained things in a way to make him understand it. And in fact, I wouldn't really do it unless he said, I feel comfortable with you doing that type of treatment for me. So that's why I do these things. I hope that piquing people's interest and sense that maybe there's a reason why the existing medical model is just failing so miserably, and that maybe there's actually a legitimate alternative to it, which is what the Yas method is. Let's be clear. The Yas method sits outside the medical system. I'm telling you, in 98% of cases, the cause of your pain is muscular. Muscular causes do not show up on diagnostic tests, and there is no medical professional capable of diagnosing these. So if you have a muscular cause, trust me, you will never get that treated in the medical system. So be open to the idea that maybe the medical system was wrong. Shit, the medical system killed George Washington, and that's a fact, right? In the 1920s, they bore holes in people's heads to fix their headaches. They gave them lobotomies for behavioral issues, and every one of those was a failure. In the 60s, in England, they gave thalidomide, which was an anxiety drug, to pregnant women, and it caused every baby to come out distorted. That was one of the most disastrous of medical failures. So what do you say? Everything makes logical sense, and that leads to trust and then physical proof. Yes. Yeah. So one of the things I really am trying to do, when I meet with somebody, by the way, we start by talking. And the whole idea of this is to try to make sure that you feel comfortable that I am using a method that makes sense, is logical, and that in my presentation to you, I'm very completely explaining how I've determined that the cause is muscular. Because before we go on and start to do the exercise, if you don't fully embrace the idea that it's muscular, you're probably not going to try real hard doing the exercises. You're not going to worry about the accuracy, and you're certainly not going to be willing to commit to it to follow through to the point at which you have the strength you need so that you could function without symptoms. So we always want to start with explanation, and then we go on to treatment and to the exercises. So let's just kind of talk about how do you get the Yas method if you want it. Well, first off, you could simply contact me via email at drmitch@mitchellyas.com. You know what? In fact, I'll just put it right down here. Okay, right there. I just loaded it on there. That's my email address. So if somebody did want to reach me to talk about their particular situation, if you're interested in setting up a Skype evaluation, by all means, you can do it through my email address, drmitch@mitchellyas.com. If you want to just get more information about the Yas method, this is YouTube. This is a YouTube live session, but there's plenty of videos there. If you want to go on Facebook, it's at the Yas method. Lots of videos there. If you want to go on my website, mitchellyas.com, my blog page, there's 80 to 100 probably blog posts there. And all of this information I'm providing is all trying to give you the theoretical basis for all this type of stuff. Why the medical system fails, why the MRI is baseless, and why a physical presentation is the only real way to understand the cause of your symptoms. And then, if it is found to be muscular, how do you actually resolve the symptoms? So I want you to have as much opportunity to get this information. And then if you do want to contact me, that would be great. I take a lot of pride in what I do. I am fortunate and feel very gifted that I've been given this very, very unique understanding. I think Dave would describe me as a very, very heavy biomechanist. I really understand the way joints work. I understand how muscles move joints. I understand how muscles work synergistically. I understand the connection of muscle to function. And if there is some sort of dysfunction, a particular activity or task that's difficult to perform, I have the capacity to understand which muscles are impeding that so we could work on the particular muscles. That's kind of the premise. Ultimately, what is the goal of the Yas method? It is always to return the person to full function and pain-free. It's not just about pain-free. If you are going to use the Yas method, the intent of it is to get you back to a higher level of function than you were probably prior to the beginning of your symptoms. That's what this is all about. If you watch my videos and you'd like to subscribe to the channel, by all means, subscribe. I think that would be a great way of helping blow the channel up, which will allow me to get more viewers. And that's really what this is about, expansion. I am a singular practitioner, but quite remarkably, I believe could have an impact on the majority of the 130 million Americans and roughly 1 billion people worldwide, because as I said, most likely 98% of those are suffering with muscular causes which have not been identified. So I really want to try to reach people. And I think mechanisms like YouTube, like Zoom are going to help me. So please like the videos, subscribe to the pages on Facebook, become a follower. And going forward, my hope is that we will expand the usage of Skype. I hope to create some exercise videos, which will help to allow people to be able to do these exercises very, very accurately, because without doing them accurately, you will not get the benefit of the exercise. Going to physical therapy, for anybody who's seen it fail, the reason was because it wasn't purposeful and wasn't designed to be accurate using the appropriate progressive resistance. So that's what makes this so effective in getting people better within weeks, not months or years. And so the exercise videos will be a great thing. I hope to have a line of my own resistance band, which will have 1-inch increments, so we can make sure that people are progressing their resistance by going to the next number. We want to make seminars and workshops available. If you have a group or organization that would like to present the YAS method to that group or organization, I am more than happy to set those up for weekends. I think would be a great thing. It's a chance for larger organizations, larger groups of people to become entrenched in the system. And the fun part of these types of workshops and seminars is that we always bring up some people, and I try to do evaluations and treatments so those watching can see the way the system is implemented and see that it actually works in practice, in application. So if you have a group organization and you'd like to discuss possibly having me come and do a weekend seminar workshop, also just contact me at Dr. Mitch at mitchellyas.com. I'll spell it DRMITCH at MITCHELLYASS.com. All right, so I see we've gone over an hour now. It's an hour and 10 minutes. So I think we're going to call it quits here. I will let people know going forward when I am going to be doing the next YouTube live session, as well as any Facebook live sessions. So let's try to work together. Let's try to spread the gospel. Let people know there is really a legitimate concept. I know that people are going to say, and it's always been an issue, oh, if it sounds too good, it can't be true. I cannot express any clearer that this is in fact true, that if in fact the cause of your pain is muscular, with just a few weeks typically of progressive resistance exercise, you can resolve the cause of that symptom and return you to full function. Clearly, there will be some cases, depending on the severity of the situation, how long the person's had the symptoms, where it might take longer, but a very, very large proportion of people can resolve their pain within just weeks. So please, let's get the YAS method. Let's end chronic pain globally. All right, for now, this is Dr. Mitchell Yas wishing you a pain-free, fully functional life. Bye-bye for now. Good night.